I don't know what the
Okay.
wait, turn off the recording so that we don't. Hello and welcome to our webinar this evening. Thank you so much for taking some time to listen to us talk about patient advocacy and kind of what we do at Wheelhouse. We'll go right into introducing our speaker this evening. Today we have Emily Bernstein, who is the CEO and founder of Wheelhouse Health Navigation. She has been a recipient of the Health Care Advocate of the Year award and is an important advocate in her hometown of Providence, Rhode Island. She's been committed to helping people like herself navigate the difficulties of obtaining, managing healthcare, and medical billing and insurance. So Emily is going to talk a little bit about Wheelhouse, describe what Patient Advocate does, and then provide some case studies from some experiences that she's had at our organization. So Emily will take it away now.
Thanks so much, Mia. So Wheelhouse, I decided to found Wheelhouse a few years ago after my mom went through a health journey of her own, and I realized how hard it was to navigate healthcare on your own. You really need somebody to come and stand next to you and make sure all of the process goes as it should and keeps it moving. So it's definitely been a really eye-opening and very valuable experience for me. I love all my clients and it's been really great to work with them. So we are based in Providence, Rhode Island. Our mission is to help people understand, afford their health care. So if there's any reason that you don't understand or you can't afford your health care, that is when you should come to us. So we provide personalized healthcare assistance by working one-on-one, and I'm a board certified patient advocate that focuses on your unique needs. So it's not a one size fits all operation. We're also grounded in public and community health. So we're committed to meeting clients where you are. So that means we bring empathy and tailored support to your situation. And we're very practiced in culturally competent care as well. Next slide. So the first question we wanted to answer is, what is a patient advocate? A lot of times people don't know that we exist. And so a big goal of ours is to make sure that you know that patient advocates are out there and we are here to help you. So, a patient advocate is an informed, objective, and professional expert in navigating the healthcare system. We provide assistance in understanding medical conditions, treatment options, insurance coverage, and other aspects of healthcare. So there's many different kinds of patient advocates. So we specialize in all kinds of different things. And there are great networks of advocates out there that can apply to your specific situation. So there are some advocates that work specifically with children. There are some advocates that specialize specifically in cardiology cases. So helping you if you get a new cardiological diagnosis of some sort. There's people who specialize in rare diseases and you can help them find support groups or resources that are a little bit harder to find. There's also a lot of foundations out there that support people with these kinds of diseases. A lot of advocates specialize in oncology. So if you get a cancer diagnosis, then you can reach out to them and they can help you navigate everything that comes with a diagnosis, which can be very overwhelming. I specifically am a billing navigator, so I help people navigate their billing issues specifically. There are also people who help with the death of a loved one. So if you have a loved one that passes away or is in the process of passing away, you can hire a death doula that would help you through the process of passing away and then navigating the grief afterward. And then there are many people who they do generalized care navigation. So that's for if you have things like diabetes or osteoporosis or sleep apnea. Those are all complicated diagnoses that, especially if you have more than one, that can get overwhelming to navigate. So there's different advocates that specialize in generalized care navigation as well. So at the start, I said that patient advocates are informed, objective, and professional. So I wanted to dive a little deeper into that. So, informed is a big part of what we do. There's a lot of education opportunities out there where advocates can continue to learn about the state of the both the industry as well as learn about different aspects of care and bringing that to their patients. Um, I myself went through a certificate program, so I got a certificate that where we discussed the medical ethics, communicating difficult conversations, the legal aspects of healthcare. So there's a lot of different areas where we can learn and get specialized. There is also a board certification, just like there is for nurses or social workers or anything like that. So the patient advocate certification board is where you become a board certified patient advocate, and those also require continuing education credits. So so as you continue to maintain your certification and your board certification, you need to continue to educate yourself as well. A big part of what we offer is an objective perspective. So, board certified patient advocates are required to be a observer kind of and help you through your situation. But we also provide distance from what is a very emotional experience a lot of times. So, and so the board certified patient advocate brings that perspective where we can be kind of level headed while we empathize with the situation. Like we can be kind of a level headed um, perspective that can help make sure that navigating these issues can go a little bit smoother. And then also there are we're professionals. So there are advocates that you can get through your healthcare system. So if you, for instance, are getting a procedure, you may be able to get a nurse navigator through the hospital that you're in. You can also potentially get a navigator who is through your insurance company. So those are different kinds of advocates that are obviously meant to help you navigate the system, but they are also constrained by the system that they're working in. And so independent advocates provide, we operate outside of all of those systems, and we're able to cross all the bridges that need to be crossed in order to get you the solution that you need. So we work with different providers, payers. We can talk to your therapist, your physical therapist, your primary care doctor, your insurance company. We can work out to all of those, and we're unburdened by institutional policies and procedures. Excuse me. So a lot of people come to me and ask, when should I call a patient advocate? A lot of times we get calls and it is as an emergency is occurring, or it is after they've received treatment, or in different states of a situation. So the correct time to call an advocate is before an emergency starts. Patient advocates are able to frequently prevent health emergencies by getting you connected to the right specialist ahead of time. We can get you the right providers and equipment and things like that. So, for instance, a lot of times we get calls and say, oh, from a loved one who says, oh, my mother just fell and we need help finding her housing. Whereas if they had called before the emergency, maybe we would have been able to get them either into different housing or get them a walker or some sort of medical equipment or some sort of care that would have prevented the emergency from happening. So a really good time to call is before there's an emergency. Other times that we get calls are when people are frustrated. And most of the time, people are frustrated with one aspect of the healthcare system or another. But maybe you're frustrated with your care team that you find that they're not listening to you, or that you're getting dismissed from them, that you are not getting the answers that you need. Um, Another time that we get calls from people is when you need care that you cannot find on your own. So, for instance, if you're dealing with multiple different diagnoses and you can't live on your own, so it's very difficult to find housing, state benefits or assistance programs, things like SNAP, Medicaid, transportation to your appointments, things like that. Those are all very difficult things to find, and a lot of people don't know where to start. And so we're able to help navigate those. We get calls from people who don't know what kind of care that they do need, so they're kind of lost and overwhelmed. And that's where we can step in to help break down those steps. Like I said, I'm a billing advocate. So if you have a bill that you can't pay, or if you, for instance, know that you were overcharged or that the insurance denied part of your bill that they should have paid, or for some reason you're just being charged more than you should be and you don't understand why that is the case, that's when you should call an advocate and we can help navigate that step by step. We get a lot of calls from caregivers that are frustrated with the care that their loved one is getting, and they don't know how to help their loved ones. So there's a lot of desperate calls from people who just want to help their loved one get better. Um, and we also are starting to work with providers. So, providers, like for instance, a mental health provider or a physical therapy office that deals with a high claim volume, if those claims are denied, they don't get paid either. So, we're working with them as well. So, how does working with the patient advocates work? If you don't know what a patient advocate is, you're obviously not going to understand how actually working with a patient advocate works. And so one thing that we are constantly thinking about is the HIPAA, which I'm sure you've heard of. I'm sure you've signed forms that with her HIPAA waivers in one way, shape, or form because you're inundated with them every time you go to the hospital. HIPAA stands for the Health Information Portability and Accountability Act, which means portability means that it can go from provider to provider, and you can actually share your health information with providers when you want to, but you have to actually explicitly state which providers that you want to share them with. And then accountability is making sure that providers are accountable for maintaining confidentiality. So when you work with a patient advocate, at least the way I function in my practice, we usually have an intro consulting call. So that's after you reach out. We do a call where we talk about what you're going through, what you're experiencing, and how I can help. I'll put together a care plan and send out a proposal to you. And then from there, you sign the contract and we do the onboarding forms. There is a fee to our services. And so that is one thing that a lot of people don't know. There is a fee to our services that is not covered by insurance at this time. So there will be an invoice for the services that is usually paid ahead of times. And then, like we mentioned, HIPAA is something we're always thinking about. So, we'll ask you to sign release of information forms, and that will give me will give me permission to work with your providers. So, for instance, if you have a bill um, from an injection that you received or from a surgery that you had, I'll need to get a HIPAA authorization for the surgeon's office, for the hospital, for your anesthesiologist, anything like that. So for any providers that were involved, we'll get authorization, and that will allow me to speak with them on your behalf. And then from there, I'm able to jump in and start taking and creating solutions for you. So my goal is always to take the stress off your shoulders so you don't have to do things like wait on hold, um, or call around, get all the phone numbers that you're supposed to be finding, stressing out about who to talk to next and where to get the information you need. And we help you make sense of your healthcare journey. I also do send out weekly updates, so I make sure that you're involved every single step of the way, so that you understand what steps I am taking and hopefully can learn from that for your next, for the next time that comes up for you. And then once this problem is solved, we'll conclude the case, and we'll send out a summary of what we did, and of course a survey because feedback is always really helpful. Excuse me. So, what are the benefits of having a patient advocate? Um, I mentioned some of these before, but I think the biggest major benefits of having a patient advocate are the objectivity that we provide, the tailored solutions that we're able to create, the expertise that we bring to every situation, and then the education that we have to back up what we're doing. So first, the objectivity is really important. You may not think about it, but when you're, especially in billing or when you get a new diagnosis, it's really, really a very emotional experience. And so are able to identify with that. We can empathize with that. As I said, I formed this business after I went through this with my mother. So I know exactly what's going on and how hard it can be. But when you are in that situation, it's very difficult to work with people on a level-headed basis. So as a third party, we're removed from that emotional burden, and we're able to provide some distance that comes with our experience, and we can present the situation without all the extra burden that comes from the personal situation of where you're coming from. We also provide tailored solutions. So we work directly with you. We're working on your case specifically, and we always strive to come up with a solution to your specific problem. A lot of people may be now relying on AI automations. There's a lot of companies out there that are trying to automate, appeals or denials, things like that, and using templates and replicable data to solve your problem. And we're more of a person to person operation. So we focus on each step as it is, as it comes, and we work through each step individually. Um, yeah. We also, when we help you out, we have come through many of these experiences as more. So as we have come through many more of these experiences as kind of the layperson has. So we've navigated similar experiences to yours, and we know when to say no and push harder. A lot of people, I think, get intimidated by the healthcare system. So one of the benefits of working with an advocate is we know how to push back when we know that you're getting unfair treatment. We learn through the repetition and experience and bring you that benefit to your situation specifically. And then I also mentioned the education part. So we mostly are educated and board certified. So we're educated ourselves, but we also strive to educate you through the process. Like I said, I send out weekly reports, and I'm always striving to make sure that health literacy is a focus of my practice. And I make sure that we can learn as much as possible, and I share that education and that learning with you as the client, to prevent it from hopefully happening in the future. Perfect. So we thought that some case studies might be a good way to help illustrate what we do in a more practical and tactical sense. So we can jump into a couple case studies here to talk about some cases of people that I have helped in the past.
Sure. And you want me to read these, or do you want to read them?
Go ahead, you can read it.
All right. So the first case study is looking at objectivity. The first objective is to look at kind of how providers missteps that prevent people from getting health care. So our situation is about a client that we've named Joe. So Joe has a hip injury that's gotten increasingly worse, and he now needs a wheelchair for personal use. Joe cannot cover this cost out of pocket and needs it to be covered by insurance. As Joe's son was helping him move to his new house, his prescription for the wheelchair was lost in the shuffle and has not been filled. The lack of the wheelchair is significantly affecting Joe's daily life as he's taken more days off from work to rest his hip and recover.
So in cases like this, we would be able to help in this situation. A lot of times, providers have paperwork or don't have the detailed information that they need in order to make things happen. So I collaborated with this person's primary care doctor and then the medical device company, and I found out that there was that on the prescription for the wheelchair there was some specific language that needed to be added, and so I got the specific language from the medical device company. I provided that to his primary care doctor, and they resubmitted the prescription, and then the prescription was approved by the insurance company, and he was able to get the wheelchair. So, like I said, those are those detailed steps. That specific language that was needed can a lot of times be lost in the shuffle by providers, and we help fill those gaps.
All right, our next case study kind of looks at the gaps in health literacy that may result in larger medical bills than are actually existed. So our situation is about Marina, who's a client or kind of a client we could have had. So Marina has recently immigrated to the United States and has never used the U.S. health insurance before. After a trip to the doctor due to what she presumed was the flu, she was faced with a medical bill of $3,000 despite having insurance. Marina feels lost and confused on why and how she was faced with this bill.
So in this case, I've had several different clients that have come to me with the bill that they received. And if you review the bill, you can see on there that there was an uninsured discount. So that was a red flag to me because she did actually have insurance. And so she was not considered uninsured at the time. And so a lot of people, if they are unfamiliar with the healthcare system, they don't know when to use their insurance ID card. And so I think in this case, Marina did not present her ID card when she went to the emergency room. And so they didn't have her insurance on file. So I called the medical billing office. I provided the coverage information and the start date of her coverage. And then they reprocessed the bill and the claim was paid entirely by insurance. So this was a gap that, she didn't know, like I said, how to present her ID card, how to ensure that her insurance would cover that procedure that she went in for that day, and make sure that her bill is covered for her.
Our third case study kind of looks at understanding reimbursement eligibility. So this situation talks about Ray. So it says Ray spends a lot of time on their feet at work and has recently suffered a back injury while cleaning out their garage. Needing to get back to work and heal their back, Ray saw a physical therapist 3 times a week for 6 months, and it was not covered by insurance. This resulted in many appointments paid for out of pocket. Ray didn't want to pay out of pocket, but their back pain was affecting their ability to work and spend time with their family.
So in this case, a lot of times there are providers, especially with physical therapy and mental health, that they don't accept insurance because it's difficult for them to manage. Like I mentioned earlier, providers have to deal with insurance just like consumers do. So in this case, she actually did have coverage for physical therapy, but the provider didn't accept her insurance. So she was able to actually pay. So we collected all the bills from the provider and submitted them through her insurance portal, and she was paid directly for at least a portion of what she paid out of pocket. Through her insurance because she was eligible. So it was better than nothing. And she was able to receive some of the funds back. And she, we worked and saved her money, and she recognized that she didn't have to pay out of pocket moving forward. There's a lot of times people have out of network benefits. So even if there's a provider that does have the insurance, that does take insurance, but is out of network, some people have coverage for that actually as well. And so you can submit for reimbursement for out of network coverage after we review your plan, and you may be eligible for reimbursement there as well. So that's another thing that we help people with all the time.
And then our last case study today is looking at appealing claims that were denied. So the situation is about a girl named Tara, who's a young adult that's just begun a new job. She's given insurance through her work, but she struggles to navigate the ins and outs of her plan. Tara's diabetes management is contingent on her ability to utilize her continuous glucose monitor, but she was denied insurance coverage to pay for the device.
So in this case, a lot of times insurance claims are denied automatically by a computer and don't actually take into consideration the coverage that people are eligible for. So so we reviewed her insurance plans in detail and found out that she is covered for continuous glucose monitors. But a lot of times, for instance, if the prescription is written with a wrong diagnosis code, or a procedure code might be off, there's all these codes that go into the back end. And so we were able to realize that they used the wrong diagnosis code, and she was actually eligible. So we had the provider revise the prescription that they used for the glucose monitor, resubmit it, and it wasn't approved and insured.
And that's all for the presentation.
All right. Thank you so much for coming. We hope this helps. We will share the slides with everyone that has joined, and we will post this on our YouTube as well for future reference.
All right, I'm going to stop the share and you can stop the recording.